Hello, I'm Felicity Cohen. I'm so excited to introduce you to my Wellness Warriors podcast. For over 20 years, I've been a passionate advocate for helping thousands of Australians find solutions to treating obesity and health-related complications through surgical intervention and holistic managed care. My podcast is dedicated to all the people, past, present and future, who have helped shape my journey and continue to inspire me to work consistently to achieve a healthier Australia in both adults and future generations. I hope you enjoy it. Good morning, Dr. Peta Stapleton. Welcome to my Wellness Warriors podcast. It's an absolute pleasure to have you here today. I'm really excited to have the opportunity to learn as much as I possibly can in the time that we have around EFT and everything that you've done in this space. It's so fascinating. But let's start a little bit with you and your background, and let's go back to the beginning, where you started. Sure. And where did you grow up, first of all?
Thank you, Felicity. In a little local seaside town right near the Hunter Valley. So grew up there right through to high school. Lovely, idyllic. I could remember, picnics on the beach after school kind of thing. And then for whatever reason, my parents made the decision around my high school time to move to the Gold Coast. So I have been here ever since, and I did marry a true Gold Coaster who was born in Gold Coast Hospital back in the day. So been here ever since.
That's amazing. What a change that place has taken and shaped up. Oh, good morning, Milo.
Hello, Milo.
Wow.
He's being part of the podcast.
So what eventually took you through to choosing to take the pathway to psychology?
Do you know, it's a funny story because I actually wanted to be a lawyer, and people laugh when they hear, given what we've done in psychology ever since. And I was finishing my grade 12. At the time I had applied for law. And for whatever reason, I guess, maybe it was just a different pathway at the time, the entry grade to get into law for that year, because it was sort of an emerging area everyone was interested in, was 5 marks higher than the one I achieved. So at the time I was devastated. Of course, you look back in hindsight and kind of go, oh, not meant to be. So I went into a Bachelor of Arts degree at Queensland University in order to upgrade to law the following year. So that was all okay, and I had one subject I needed to do, and I was doing all these preliminary law subjects that would count. And it was a little bit dry and boring, and I had one subject to do, and my mother said, we're flicking through the book, why don't you do a psychology subject? And I looked, we didn't know any psychologists, it wasn't sort of an emerging area. And I'm like, what's that? And I read the introduction about learn all about yourself and behaviours, and I think, oh, okay, that might be all right. So I do this subject, and I'm not joking, I can still remember the lecture room. It was like this light bulb moment that it just made sense, and I guess it was helpful for me personally, and it just changed my pathway, and I didn't look back. So I changed my whole degree at that point, and I had no room for movement because I'd used all my electives up, and I just had to end up doing all of psychology. And really, I was the first person even in the family and wider circle, because everyone's like, what's a psychologist? I was often confused with being a psychic at the time. So that I look back and I laugh because I wanted to be a lawyer, but of course, the pathway was very different.
I think it's so fascinating to see how much psychology and psychologists, the role of psychologists and our attitude to the role of a psychologist has changed for me in my career, which has spanned here in this particular role over 21 years. And I've always been really a great advocate for psychologists working with our bariatric patients. And years ago, people would be terrified. They used to feel like they had to pass a test. But that shift has been quite dramatic.
Yes.
And the acceptance of how we work with psychologists from a public perception kind of attitude has changed so much.
Absolutely.
What do you think are some of the things that have shaped that change?
I absolutely think when Medicare came in, the Better Access program that allowed the wider community to access psychologists and perhaps, even have that sort of bulk build and things like that. We saw a shift then that it absolutely opened up, I guess, what was used to be people that could access psychologists perhaps needed to be able to fund it themselves or certainly have private health insurance and things like that. And there was an opening of a door there that I think was of absolute benefit to everybody in the community, because people then, if they felt they needed to, could access much more easily. And we saw an acceptance of psychology at that point that really hadn't existed in my early career.
Amazing. And I think even now more than ever, the role of psychologists in our community has become incredibly prominent. I think we need it more and more. We know that dealing with, working in the era that we are right now, in the here and now, there's so much more stress, anxiety, depression.
Yeah.
Of course, there's a lot of PTSD, but we're living in a moment where that overwhelm phase, because of massive change in our working lives, in our home lives, and if we just look at this small period over the last 12 to 18 months, how that has probably changed a lot, how psychologists are working with people to support, assist and guide them. And I'm sure the role of EFT in that space has been quite important.
Yeah, certainly the last, like you said, 12 to 18 months just of stress in general, but even pre that, the emerging technologies that we've had that have, I guess, impacted our teenagers coming through, and stress being probably the most presenting problem that, more and more I think there is absolutely a need for people to have access to stress reduction techniques that they can self-apply, that they can use immediately, get an outcome, which is why we are so passionate about some of these body-based somatic approaches, because I think, to have that kind of on tap for yourself, particularly moving forward, is going to be of absolute, importance, particularly for chronic illness and things like that.
So I know a little bit about EFT and I'm really looking forward to learning more. So effective freedom technique is the full term for EFT, and I know it's been encouraged or used in some schools. How is it used effectively with children and in a school setting? Tell me a little bit about how that's actually evolved and become effective.
Yeah, so the first invitations from our team, or for our team with EFT in schools, came out of some of our food craving research. So just media around that had sort of, we were talking about it reduces anxiety, which helps a food craving reduce. And of course some teachers had seen it and reached out, some local schools, and said, would this work for things like test anxiety when students go into an exam, get that kind of performance, even giving speeches? And we said, absolutely, of course, it just reduces stress. So out of that came some research trials that emerged and have since been published, where we actually taught sort of, 14, 15-year-olds in high school settings locally how to use it for reduction of, anxiety for those different scenarios. Some of them went on to use it for other things, reducing their kind of soft drink cravings and things like that, which was really good. But then it started to kind of emerge out into primary schools. So we had teachers starting to apply it in a classroom setting. So before a spelling test for younger kids, they would do some tapping just to help themselves remember or stay calm. And then they would even do tapping after an exam or a little spelling test, just to calm themselves down in case they thought they got something wrong. So we had teachers reporting back to us they were actually tracking their grades as well and noticing these students' grades were improving. And of course, teachers were applying it themselves for their own stress. And that's the biggest thing that we advocate, is that if a teacher can stay calm in front of a classroom, the classroom responds to that. So teachers really taking that on board. So out of all of this, emerged tapping in the classroom, which is now a worldwide program that we've had more than 1,000 teachers worldwide access and train in, so they use it in daily classroom situations or for themselves as the teacher in those rooms. So it's been phenomenal to watch, because it was not an area that we had expected to kind of go into or lead, but it is what it is, and it's become that of its own accord.
I love that, and I think it's fabulous that we can teach children, obviously the impact from the teaching staff as well, but for kids, I think it's so much more practical and a lot more easier to teach this kind of a technique as a stress reduction as opposed to teaching the meditation.
Yes, particularly I think for kids that might have a bit of, sort of the ADHD or even just a small child with energy, to be able to physically tap even with both hands and use the body is so much more appealing to them. The other thing I like about children is they don't question how does it work. So we just say to them, look, try this, it'll make you feel better. And they go, okay, just do it with both hands. It's very quick for them because they don't have lots of layers. And they then say, oh, well, that worked, I'll do it again next time. So it is a really, I think, useful area to teach them so that they keep using it all the way through. And I just hope that we do get that one day, that, it is just a standard technique that every child learns.
Amazing. And we've used it here in our centre, and I'm just happy to share with you that through our Project GRIT, which is for our childhood prevention obesity program, we've used that in our pilot study, and the results show that their self-concept scores were one of the most elevated results
fantastic.
throughout. Yeah, absolutely fantastic.
Yes.
And I really do attribute that to our psychologists teaching the children in the program how to use it.
Yeah, that's fantastic.
Yeah, amazing. You've been involved in more than 100 research papers, which is pretty phenomenal. Tell me a little bit about how you actually entered into the research space with regards to EFT and how it's helped grow and evolve the whole movement.
Yeah, it is a funny story. So I had been introduced to EFT through a colleague at the time. I was in the eating disorder space with traditional sort of anorexia, bulimia nervosa. Finding a lot of traditional techniques we'd been trained in 25 years ago weren't that effective, which we now know weren't. So I was sort of complaining, if you like, and he'd found back in the days of dial-up internet, he'd found a little bit about tapping online and said, look, I think this thing might have something to it. Of course, I dismissed him at the time, but eventually did learn. And we were using it with clients in private practice, kind of going, oh, I think this might actually work. Clients were recovering as well from their eating disorders. So at the time, my academic role, which was at Griffith University in the School of Medicine, had a research component. So my then, boss, who was a very conservative musculoskeletal GP, said, okay, so you do need to do research as part of your job. What would you like to research? And I said, well, look, I've been using this unusual sort of technique, stress reduction, but look, I think it's got legs to it. I'd really like to maybe apply that, particularly in the emerging obesity crisis we were having. I think we might be able to reduce food cravings, which would eventually lead to weight loss over time. And I'm not joking, he looked at me and kind of went, oh, that's a bit strange. And he said, I don't think anybody will come to that trial, but you can give it a go. And I went, okay. So I go on a current affair program at the time, just to sort of advertise, hey, we've got this free clinical program, here's what you need to commit to, and I do a demonstration of tapping with the chocolate muffin with the reporter. Anyway, we had 4,000 people respond to that TV program to want to be in the trial. So my boss at the time, of course, sort of went, do you know what you're doing? I said, not really. So we went on, we ran that trial, and of course that was the start of our journey. Now what's really funny that I've never really talked about was the reporter a year later. I contacted him to say, look, we have got our preliminary results. Would you like to do another story for us? And he'd moved on to another network, but he said, I don't know what you did that day, but I can't eat chocolate muffins anymore. So it actually had an effect on him in the moment.
That's incredible.
It was incredible. So we've gone on, and obviously now I've probably had 15 years in that research space, where particularly in that food craving weight loss space, but we indeed have emerged out and we've done clinical trials on major depression, we've done trauma, we're currently in the chronic pain space. In 2020 we ran a cancer support trial for cancer patients to use it for that. So we have done in our school trials, of course, so we have been applying it in different areas over the decade.
That's incredible. Tell me a little bit about the chronic pain intervention and how effective that is. Where are you up to in that research project at the moment?
Yes, it has been phenomenal. So for the whole of 2020, we did deliver it in 2 different styles. So it was online due to our pandemic, which was still highly effective. And we have analysed this to date. So we had a group that went through a self-paced version. So it was sort of drip fed over a 6-week period, all online, videos, mostly of myself, walking them through, and they had access to me in a private group so that I could answer questions live. So they went through that by themselves. And then we had another group that every week for the 6 weeks joined a live facilitator-led session, but online. So we've completed that phase and we're now in their 12-month follow-up, which is exciting to start to look at that data. We've looked at that data to date and we've actually found that the 2 modes of delivery have been equivalent. So they actually absolutely got a reduction in severity of pain, psychological things like anxiety and depression respond positively, of course. Quality of life responded. So we know that if pain severity and intensity can reduce, other parts of the life do respond for that sufferer. And what's more exciting is now we're in a phase of that trial where we're actually doing fMRI testing. So we're actually looking at vagal tone as well as MRIs of those patients. So we're actually seeing what shifts in the brain as part of that. So we're right in the middle of that right now.
Really fascinating. I think it's also really interesting to see how we can cross-pollinate different modes of treatment when you're looking at something like pain. We have a startup here that is actually using medicinal cannabis for treatment of chronic pain. And I have a patient who recently came in and she was prescribed medicinal cannabis for plantar fasciitis, really chronic. She could hardly move. She had could hardly put her feet on the floor in the morning. But what she reported was not just did her pain resolve, but her anxiety suddenly resolved as a side outcome from that. And she works in a childcare centre environment, managing a lot of people, changed her life. But also using, something like tapping as a part of the treatment overall approach, a lot more holistic, I guess, in nature, can see some incredible outcomes in these areas.
And I think pain's such a good example of that. 1 in 5 Aussie adults suffer chronic pain, which is incredibly high, and probably one of the highest in the world. But the areas of life chronic pain evades into is quite comprehensive. Like it ruins so many aspects. On average, our sufferers in our trial have been suffering 14 years. So that is the average. Some are certainly much more than that, but the average length of suffering is 14 years, and they're not getting relief from traditional kind of, pharmacological intervention, and even some psychological. So we have found that, 6 and 12 months later, I do get emails back when I send out the survey saying, I forgot I was in your trial because I haven't had any pain. Happy to fill out the survey, but I'm getting those emails because it's not in their life anymore. We do know with tapping too that the intervention period is enough dose that they don't actually have to keep tapping. So it is often, even in the food craving space, that is enough what they do with us, and it lasts over time.
So what kind of duration are we talking about that they're actually actively practicing it?
So for the pain trial, it's been 12 hours over 6 weeks. We encourage them in between those sessions to do tap, so they may actually be using it daily, and we like that daily habit to sort of eventuate. But really, if they were just to do their 2-hour session, and that's mostly tapping over that 12 hours, that has been enough. Sometimes we extend to 16 hours if we're in the weight space, but somewhere around that is enough to keep them kind of, adhering to the program, not getting bored. And really, we have asked only about 5% go on to keep using it for the rest of their life for other areas.
Amazing. So in the weight space, obviously that's my passion every single day of my life, and has been, for over 21 years. And I know that you've had a lot of exposure to the bariatric patient population, but implementing tapping as well as part of their process.
Yes.
Tell me a little bit about that, and what have you experienced with that patient population?
Yeah, so that's really where we spent a good decade researching, was people that perhaps hadn't had success elsewhere. So teaching them not only around portion control but emotional eating, tapping really shines there to help people sort of, intervene with that perhaps peak of craving, anxiety, or increase in emotion, that if they remember to tap, or they even do it retrospectively, it can kind of be done a bit earlier next time, has a profound impact because they realise they've got the ability to do it without necessarily having someone there with them. It works really quickly and it lasts over time. So once they have that physical experience, they're more likely to do it next time as well. So not only do they lose weight within time, but it really gives them this ability to kind of take control of how they feel. And I think, there's no willpower needed, there's none of that. And I think that's the most important thing, particularly in that weight space, because as you know, people have had so many different journeys in the weight area and different things they've tried. We often get them where they've tried everything and they're like, okay, this is the last resort, I'll just give this a go. So there's often a lot of that kind of doubt that something will help me. And we even can apply tapping to doubt, which I think is, really important to sort of remove that element of, I hope this works, but I don't know that it will. So we actually apply tapping to that kind of belief system before we even get started.
It's so vast, the application across so many different areas, and you've grown the space so much. You've been an absolute pioneer, not just in the research, but in developing the whole, I'm calling it a movement because I feel like it's actually grown.
We call it the fourth wave.
Fourth wave, I like that
That's
too.
what we call it.
Okay, why the fourth wave?
So the fourth wave in the therapy space. So the first 3 waves, just quickly in case anyone's wondering, the first wave in therapy was very much the psychodynamic Freud lying on the couch. Lasted for hundreds of years. The second wave emerged in the 70s, which was the behaviour therapy, which we still use in parenting techniques and things like that, but it really didn't consider any psychological contribution. It was more about change behaviour, you can change things. That's a bit hard for adults. The third wave that emerged was the cognitive element to behaviour. So we now have cognitive behavioural therapy, and offshoots of that include mindfulness or acceptance and commitment therapy. So there's still the third wave where the mind and body was still integrated. But the fourth wave that we believe now is sort of, gathering steam, bit of a tsunami maybe, is where the cognitive and behavioural is now having the physical, the somatic added back to it. So EFT tapping is definitely that fourth wave, but so is EMDR, the eye movement, which now is an acceptable gold standard therapy for trauma. So that's a fourth wave therapy as well as EFT. So we're sort of saying, look, I think the therapy space for a lot of psychologists is shifting, and it's almost like it's not new. We're just coming back to something that was done a long time ago, or people that are in the yoga area will know that we've always used movement and body to release distress and things like that. So fourth wave, movement, I'm happy with any of those words.
I love that, and I think it's great to be able to apply all of these different therapeutic applications to treat any one disorder, basically, if we can actually apply mindfulness, meditation, yoga, EFT, and combine these therapies. And I think in our environment, a lot of the psychologists are, looking at different modalities to support individual patients and assessing obviously on individual need-based situation. But I think it's great that we can be so open to using a whole range of things to become effective for any patient.
I think so, because I think, if we hold that, it's what the patient needs. And that's probably what prompted my journey. I wasn't too hung up, way back. People say I was outside the square, but all I was looking for the right thing for the client or the patient, which in that case I was able to sort of put aside skepticism or the fact that evidence wasn't there at that time and sort of go, okay, well, does it work for the patient? And I think duty of care says we should be considering things like that rather than maybe getting hung up necessarily onto someone give it a tick. So now we have the research to back something like EFT, but also, the safety and efficacy has emerged alongside that as well. So yeah, I'm all for what's going to help the patient.
And it's amazing that we've got so much evidence-based information to drive this further forward. And I love the fact that it's becoming a bit of a tsunami, and I feel like that's the state that we're in right now. As far as the fourth wave evolution, and just continuing its growth, what's the international landscape look like, and how have you impacted that through your research?
Yeah, it has certainly grown, and because it's still a small field, we're all quite connected still, and I think, technology's allowed that, which has been fantastic. Certainly we do know, and we have been able to track that the Australian research that we've done in this area has absolutely impacted government policy overseas. So in the UK, the NICE, so the National Institute of Clinical Excellence, now approves EFT for government funding in the trauma space, and our research was included in that submission. The Canadian Psychotherapy Association approves it, the Veterans Affairs approve it as a safe therapy for war vets for PTSD. There's lots of pockets. The National Disability Insurance Scheme here in Australia approves EFT under self-managed plans. And our research has actually figured into those acceptances. So we are seeing it not just here, but internationally. And, it's funny because we just go to our job every day and we do our thing and we run our little trials, but to see the impact like that, sometimes we have to sit back, and I'm probably at risk sometimes of staring at the tree rather than looking at the whole forest, but it's really good to sit back and kind of go, we are shifting things here as a collective, and it's only for the good. It's certainly not, and we are getting that recognition, so we will see within our lifetime that the acceptance is there for it mainstream.
Phenomenal. What a great decision that you actually chose to move into psychology and not law.
I don't know what I would have done.
How lucky are we that you've actually just pioneered an incredible body of work and opportunity for change that's going to impact a lot of people.
Thank you.
Congratulations for all of that. So I'm actually going to ask you to guide me through a bit of an EFT for myself. So first of all, I'll use myself as the subject. I've got to tell you that today I feel like, and this is just me being completely open, honest and transparent, I'm in a state of overwhelm today.
Okay.
So I've had a massive week. It's been chaotic.
Sure.
So can we...
Yeah. How would we do it?
If you're in overwhelm, as I am today,
yes,
what would be the best approach for me to deal with that scenario?
Yes. So to just walk you through exactly what we would do with somebody. Is we would typically sort of say, Felicity, do you feel it anywhere in your body in particular, or your head? Like if you did a quick body scan, is there anywhere in particular you would feel that overwhelm?
I think often just in your chest, and you feel like I'm about to burst into tears.
Yeah,
you know, that kind of sensation.
Good. If I said, if you could put a number on it out of 10, just to tell me how strong it is, 10's your highest, 0 is it doesn't exist. You could guess a number, what would that be?
I'll give myself a 7.5. I mean, I'm typically the most resilient person you'll ever meet, so I don't get into that state.
About 7.5, so it's still
let's
significant.
Give it that. Okay. That's high for me.
That's high.
On my scale.
So because you're in touch with it, it's a great time to do tapping if you actually can. And the first thing we do is tap on the side of the hand just with, just the dominant hand there, 2 fingers, and we repeat a setup statement just to tune into it. So if I just make something up, repeat after me.
Okay.
Even though I feel really overwhelmed today.
Even though I feel really overwhelmed today.
I can feel it in my body.
I can feel it in my body.
I've had a huge week.
I've had a huge week.
I accept this is how I feel.
I accept this is how I feel.
Even though I can feel this in my chest.
Even though I can feel this in my chest.
On the verge of tears.
On the verge of tears.
I accept this is how I feel.
I accept this is how I feel.
Even though I've got this overwhelmed feeling.
Even though I've got this overwhelmed feeling.
About 7.5 out of 10.
About 7.5 out of 10.
I accept this is how I feel.
I accept this is how I feel.
So then we come up to the pressure points, and I'll just walk you through what they all are. So first one's the start of the eyebrow, and we just repeat 1 word, 2 words that describe the feeling just to stay in tune. So overwhelmed.
Overwhelmed.
Next one's the side of the eye, and we would say I'm overwhelmed.
I'm overwhelmed.
Under the eye, I'm overwhelmed.
I'm overwhelmed.
Under the nose, feeling in my chest.
Feeling in my chest.
On the chin crease there, overwhelmed.
Overwhelmed.
Now this one's just under the collarbone, about 1 inch.
Okay.
This overwhelmed feeling.
This overwhelmed feeling.
The next one is under the arm, about 4 inches under the armpit. This overwhelmed feeling.
This overwhelmed feeling.
Top of the head, I tend to use a flat palm there.
Okay.
And in the centre, same thing, this feeling in my chest.
This feeling in my chest.
And then that's 1 round of tapping. So we would just stop and go, just have a breath, collect yourself. Tune in. You might think about the week. You might think about just how do I feel right now. Guess that number out of 10 just now after 1 round.
5.
5. So it's just whatever comes to mind. That is just your subjective guess. It gives you some way. I like to keep going until we're a bit lower because it's still halfway.
Yep.
So we just come back to the eyebrow, and let's do 1 more round just to see.
Why not?
And we just focus in. If it's the same feeling, we say the same word. If you want to change the word, you can. So if you went, actually, overwhelmed's not the right description, you could say a different word.
Yeah.
Let's say overwhelmed.
Overwhelmed.
This overwhelmed feeling in my chest.
This overwhelmed feeling in my chest.
Verge of tears.
Verge of tears.
I'm overwhelmed.
I'm overwhelmed.
Been a huge week.
Been a huge week.
Feel overwhelmed.
Feel overwhelmed.
Overwhelmed at the end of the week.
Overwhelmed at the end of the week.
I feel overwhelmed.
I feel overwhelmed.
Stop and have a breath. Just check in. How's it feel at the moment?
That I can actually sense that there's a sensory kind of experience where I feel more relaxed, and I feel like that sensation of overwhelm has already reduced a lot already.
Yeah, so you can guess a number, you can go on the feeling in the body. What's important is to note if anyone's giving this a go at home.
Yeah.
If when you're tapping you start to get other thoughts that pop to mind, sometimes they're important to pay attention to. So if for whatever reason you thought about what happened on Tuesday, that could be the source of the overwhelm. So then we would say, okay, let's talk about Tuesday, and we would go down that way.
Picked the right day.
How did I?
You guessed that well. That's hilarious.
So then we won't do it here, but we would go back and go, okay, well, let's talk about what happened on Tuesday, because maybe it's still lingering.
Yeah.
And that's where we can just talk through and talk through feelings and kind of, replay it and get that reduction down so that,
Fabulous. I love that I've used myself as a subject this morning, and I'm only human, and it's interesting to see how that actually can change your whole sensation.
Yeah.
Amazing.
I know.
So tell me a little bit about the future of where you would like to go next, and what areas of research do you feel have been untapped, and what would you like to see happen?
Yeah, definitely. I think we'll stay in the chronic pain space for quite a while. It's such an emerging area, and with regulation of opioids in Australia as well as the US, this space I think we could do a lot more in. So we will end up comparing to gold standard therapies like cognitive behavioural therapy and things like that. We are getting ourselves in a position to start to make those applications and submissions to our government to have it approved. So I can tell you that is happening. How long that will take, I don't know. But we have tapping on our side, so we'll just keep using it. So we are going to, for the sake of the wider allied health community, seek to have this approved. So I put that out there so that people can sort of be assured. Sometimes people want that before they'll venture into the space. I do see that when that happens, we will probably have an avalanche of people wanting to explore and train in this space, which we currently do offer, but to support those people with how they can actually use this effectively and with guidance. So we'll end up doing that as well.
So end goal, would it be a Medicare item number for doctors to be able to refer into so that patients are fully covered for EFT?
Yeah, so we would see that it's included on the focused psychological strategies list, which is obviously for psychologists plus allied health that maybe are approved to legitimately be able to claim if they go and see somebody for therapy.
Yeah.
Yeah.
Fabulous.
Yes. The phone. Didn't even notice that actually.
That's exciting, and I love the area of chronic pain that you're focusing on, and given the numbers that you've quoted earlier, really significant work to be done. Have you seen patients have a reduction in their medication? So any of the pharmacological therapies that they've been prescribed, are they lowering their dosage, and is that one of your control mechanisms?
Yes, so we've looked at that in previous studies. So we did run a pilot some years ago with the persistent pain program that's federally funded here at Robina, and they include tapping in their 12-month persistent pain program, which is fantastic. And they were able to track for us, after we ran the EFT component, the reductions, and they were using tapping to support the reductions in medications. So we have actually tracked that in the past and seen those outcomes. We're particularly interested in this trial as to the, I guess, influence of trauma in childhood. So we're actually tracking that. We're tracking obviously the brain changes, but we're also tracking the impact of tapping on the vagus nerve. So we are working with Stephen Porges' team of polyvagal theory in the US, and we have a device that is able to measure whether somebody's vagal tone and efficiency improves with tapping. So we're actually tracking physiological measurements during this trial as well, and they're significant ones that I think give us an explanation, because often people will say, well, why does it last so long over time? So we've done a 2-year follow-up on our weight patients, and 2 years later, one, they can't remember the food they tapped on because they don't eat it. They don't even remember it was part of their life. They don't remember other things that really distress them because they don't anymore. And the questions always be, why does it last? They don't have to keep tapping. And we do think that maybe what we're doing is actually improving the vagal efficiency in people, which that vagal nerve is really important for emotional regulation and fight or flight. So we're actually tracking quite a few of those things. We do get a history of their medications, so we will be able to have a look in the data at how that shifts over time for people as well.
Fantastic. I'm very excited by the work that you're doing, and I'm also very excited to see the ongoing development and acceptance and integration of EFT for psychologists specifically in so many different treatment areas. So a massive congratulations for the work that you're doing, and I can't wait to follow it into the future. And thank you so much for coming onto the podcast today. I have one final question that I love to ask every guest coming on the podcast. What does wellness mean to you?
Oh, wow. Isn't that a good one? I guess to me, because I'm a health psychologist as well as a clinical one and was first, wellness is an all-encompassing concept to me. So wellness is not necessarily about balance or what I'm eating or what I'm exercising, but it's also my connection that might occur in my life as well, and that could be to family or friends depending on stage of life. So wellness is an all-encompassing state of mind for me, as well as the behaviours that you might see that kind of indicate things like that. So I guess if I was to sit back and sort of say at any moment, am I practicing wellness in my life, it would be a jigsaw puzzle piece And I'm probably not one to advocate for balance, because I think, it may be an artificial concept, and sometimes we choose to do things, for a purpose to, run a clinical trial and then later on sort of balance that out. So yeah, wellness takes in a lot of things for me, and I hope I do walk the talk, not only for my students that we teach, but the clients that we see as well.
I'm convinced that you do.
I certainly do tapping.
And I actually feel very reassured that you've said that balance is an artificial kind of concept, because you can't spend a lifetime striving for something that's an imperfection. No. And that's what we're doing when we look at balance. It's actually not attainable.
No, yes, I absolutely agree. And I think working in eating disorders with all that perfectionism is probably where I came to that concept too.
Love it. Thank you very much for coming in today.
My pleasure.
Please thank Dr Peta Stapleton.
Thanks, everyone.
Thank you for joining the Wellness Warriors podcast. It's been a pleasure to have you online with us. If you enjoyed the series, please leave your review, subscribe and follow, and we look forward to sharing many more stories with you in the future.